My fellow Anguillans, all I can do at this point is to appeal to you and ask you for your support. I am prepared to serve you faithfully once elected, and I'd like you over the next couple of weeks and months to follow this campaign as we continue to bring messages of hope to the people of Anguilla generally, but certainly to you in this constituency. There are lots of other things we'll talk about as we go forward. We also have some plans to look at sporting facilities, but I'm not going to bore you with that tonight. But at some future time, we're going to talk about that, because there's absolutely no reason why we cannot have facilities in place that will give our young people things to do, recreational things to do, after they finish work in the day. There is no reason why our young people can't go to a well modern sporting facility. The government of Anguilla has been promising this for years. Nothing has been delivered. Nothing has been delivered. One of the things that I'm hoping that we can do as well is to change our school day so that school starts earlier, and all of our children will engage in sporting and just total development opportunities after the normal school day, which hopefully will end around 2 o'clock. So our children can get involved in music. They can get involved in sporting activities, swimming, athletics, football, cricket, taekwondo. They can do arts and crafts. A whole host of programs which are not based on books per se, but really part of their social and well-rounded development. This kind of thing is done all across the world, all across Europe, all across Asia, all across North America. There are programs where young people are trained in a whole wide range of things. But for some reason, in a lot of the Caribbean islands, our children are virtually abandoned after school while their parents are at work. This way we can have programs to engage our children here in Anguilla and expose them to all kinds of things. Those people whose parents can afford it will send their children to taekwondo, they will send them to music, they play soccer, and they get them all the gear. This should be a fundamental right in this country. This should be a fundamental right in this country, where children are exposed to a whole wide range of activities that will help them to develop in a number of areas. I will speak to this in more detail again, but it certainly is one of the things that I'm out there promoting, because I believe that it has to be done. We must find a way to do it, and I have some thoughts as to how this can be funded. I'll speak to you just briefly on one other thing before I close, and that has to do with health insurance. I started tonight by telling you about how much it's going to cost in deposit just to get treated at the hospital. But for many years, our government has been toying with the idea of health insurance for the people of this country. 15,000 people, and I believe it's probably less than that. The actual Anguillan population is probably around 13,000 people. Having a national health program for 13,000 people is not difficult. It is not difficult. The smallest company I worked for in the United States had a staff of around 25,000 people. In addition to that, that employee would have a spouse, a husband, or a wife, so that's 50,000. Let's assume that he had 2 children. It's 100,000 people. And it was a non-issue to have health insurance for 100,000 people. Here in Anguilla, we're talking about having a health insurance scheme for 13,000 people. It is easily done. And what I would like to propose is that we have a system whereby each employee pays a premium. So you pay some money, like you pay Social Security, and a body is set up, like Social Security governing body, who will then have insurance companies submit bids to provide insurance coverage for the 13,000 people in this island. And the business of ensuring the people of this island would be given to 1 or 2 or 3 insurance companies. That way, when you go to the hospital, you need only show a card and you're covered. You go to the hospital in an emergency, you got to have a C-section. Can you imagine that they're going to say we can't touch you because you need to pay a deposit of $2,600? If we had a national health insurance scheme, you merely show your card and you're covered. That's where we need to go with our health insurance. Yes, you're going to pay a monthly fee for that. But that, after a while, will be absorbed and you don't even worry about it like today you have Social Security and you just pay it knowing that it is there. In a similar way, you pay a premium for your insurance, but when you have a need for a major medical problem that could cost sometimes in excess of $1 million, if most of us had a health problem where we had to pay $1 million for our health care, we would die.